Hi everyone, I'm Katharina Kang, Mission Programs Manager at Komen, North Texas. I'm excited to be back with you again for our monthly educational series. If you missed last month's episode about breast cancer risk or our May episode about breast cancer screening, be sure to check them out, especially the one on screening, which is basically the part 1 to today's part 2 video on diagnostic tests. As a refresher, screening tests are used to find breast cancer before any warning signs or symptoms appear. If someone already has noticed a warning sign of breast cancer, like a lump or a rash, and goes to get a mammogram or other tests, this is actually a diagnostic test. Most of the time, these abnormalities don't turn out to be breast cancer. However, the only way to know for sure is through follow-up tests. Here's an example of how this might look. First, a woman goes in for her annual screening mammogram. She's feeling good, there's no problems or symptoms to report. Shortly afterwards, she gets a call from her physician or imaging center, and the tests have shown something abnormal. Her doctor orders a follow-up test like a diagnostic mammogram or a breast ultrasound. In some cases, additional tests such as a breast MRI may be recommended. And don't worry, I'll explain more about all of these imaging tests in a bit. At this point, if the finding does not look like breast cancer, for example, it's a cyst, no further testing is needed, and she will return to her regular schedule of breast cancer screening with clinical breast exams and mammograms. However, if the finding looks like it might be breast cancer, the next step is to do a biopsy to remove some of the tissue to confirm whether or not it is cancer. A biopsy removes cells or tissue from the suspicious area of the breast. The cells or tissue are studied under a microscope to see if cancer is present. A biopsy can seem scary, but most breast biopsies in the U.S. are not breast cancer. Still, the biopsy is needed to determine whether or not something is cancer. There are two main types of biopsies used to diagnose or rule out breast cancer. Number 1, needle biopsies. With a needle biopsy, a healthcare provider removes a small amount of tissue or cells with a needle. And number 2, surgical biopsies. With a surgical biopsy, a surgeon makes a cut or incision in the breast to remove a larger tissue sample. Your provider will decide which type of biopsy is best for your case. Afterwards, the breast tissue that was removed will be sent to a pathologist. They will examine the tissue and prepare a report of the findings, including the diagnosis. And by the way, if you've heard that exposing breast cancer to air during surgery or cutting through the cancer might cause it to spread, please know that this is a myth. Surgical and needle biopsies do not cause breast cancer to spread. Now that you know about the process to find out if an abnormal finding is breast cancer, let's go back and talk about these imaging tests. Diagnostic mammogram. If a woman had an abnormal finding during a screening mammogram or clinical breast exam, she will need a diagnostic mammogram. It's a way to further examine symptoms of breast cancer, such as swelling, skin dimpling, or pain that doesn't go away. It involves 2 or more X-ray views of the breast. The doctor uses the same machine as a regular screening mammogram, but instead of taking images of the entire breast, the images focus on the specific area that looks suspicious. Breast ultrasound. This is a diagnostic test that uses sound waves to create images of tissues and organs. Tissues of different densities reflect sound waves differently. It's similar to the ultrasound machine that doctors use on pregnant women. Breast magnetic resonance imaging, or MRI. This is an imaging technique that uses a magnet linked to a computer to make detailed pictures of organs or soft tissues in the body. Don't worry, there's no pop quiz for these definitions. In fact, if you want to learn more about each of these, just head to Komen.org. There's tons of information on these tests and biopsies, as well as a section called Questions to Ask Your Doctor if you do find yourself needing a diagnostic test. We'll add the link in the video description below. For all of us at Komen, North Texas, funding diagnostic tests is a key part of how we support women and men across our 13-county service area. The services our grantees provide are important because while insurance policies may cover a screening mammogram as part of routine care, follow-up diagnostic tests may not be covered, and these can be expensive. We want to ensure that North Texans can have access to the care they need, and thanks to you, we made it possible for 412 women to receive Komen-funded clinical breast exams, screening tests, and diagnostic tests last year. Thanks for your support of Komen, North Texas, and for our community, especially those of you who joined us for our Plano Race for the Cure on June 10th. Don't forget that fundraising for that event will continue until July 14th, so there's still time to donate to your favorite racer or team and have that money directly impact the women and men who need our help the most. That's it for today, and don't forget, if you have additional questions about diagnostic screening, visit Komen.org or submit it in the comments section below. Thanks, and we'll see you next time.